morning. I am Dr. Prashant BN, arthroplasty and robotic surgeon from Narayana, Homsandra. So today, as all of you know, I will just briefly tell about the advantage of this robotic surgery. So to give an example, I will take this patient by name Nagaraj. So he has a pain in the knee. He has difficulty in walking. Yeah. So you can understand his difficulty in walking. He has undergone surgery in his right leg 7 years back in Kerala. So with the effort of the surgeon, the fracture on that side has united. But with the time, he has developed a deformity in the knee. His X-ray would look something like this. He has a knee where there is an implant inside. The knee is badly damaged. Just for comparison, I have put a normal X-ray. This is the difference between his damaged knee and a normal knee. The same thing is on his lateral view also. So conventionally what we do, we expose the knee, we take a point on the knee joint, we pass a rod inside the knee joint so that we know the axis of the knee, so that we can keep the implant in proper position. For that, the rod has to go inside. Since this person has an implant inside, I cannot put a rod inside. So for that to do, I have to take his implants out. That is one more surgery. At his age, definitely more challenging. I need to take his implant out, wait for the wound to heal. Once that is healed, then I have to progress for the next surgery. So since I have robo, so I have the advantage of doing the surgery without taking the implants out. So how do we do that? We take the planning preoperatively. This planning would show us what is the angle of deformity. The same thing is confirmed with the CT scan, and we on the 3D model, we understand where exactly we place the implant, where and all the screw can come in position, which all the implant that need to be removed, which can be left inside. And once that planning is done, we exactly know where the implant sits and what is the millimeter of bone that we will be taking out. So since we know all these things parameter very early, it is very easy for us to do a surgery. Definitely the surgery happens faster. So since the surgery was going faster, we would combine both the knee surgeries together without much difficulty. So this is how the plan would look. Since our robo is a small pen-like thing which works with a small burr, it can go in between on a small space and do the job and come back. So that's why my incision, my cut wound on the surgery might not be bigger one. With the small incision, without cutting the muscle, this is what is called subvastus approach. Without cutting the muscle, we can perform the surgery. The advantage of this is definitely the wound size is less. Since we don't cut the muscle loss or the muscle weakness is less, so the recovery is faster and better, and there is no need of aggressive physiotherapy required, and definitely it can be conveniently done in older age because the blood loss is less and the pain factor is less. So once the surgery is done, the closure, that is. The same thing I had explained in an article where this surgery has an advantage of small incision, no muscle cut, less blood loss, and less pain, less physio, and fast recovery. So during the surgery, before we put the implant in, we have to plan the surgery, and we see the planning is done for the bone part. Then we see how it coordinates with the soft tissue part, how the ligaments are balanced. So that's what happens on the on table. Once this balancing is done, then the robo does the surgery. In this surgery, there is a small drill which goes inside the bone and cuts off. So that's why this can be performed with a small incision. Okay, so it is much more precise. For example, so we can see on the screen the maximum tightness on the tissue, what computer has measured, and with the stress what we have measured is 100% matching. So the balancing is very good. Then definitely, since the balancing is good, the patient's activity will become pain-free. The same thing, we can increase the bone resection if there is a bone defect. Then also we can balance it comfortably. The same thing I had explained in an article about what are the advantages of using a robo. So for this patient, so post-surgery, this is how his X-ray looks. His implants are in place. Without removing the implant, the knee surgery was done comfortably. And since this was combined with other knee surgery, his pain on both the knees are gone. So his rehabilitation was good and he was walking comfortably. See, down the line at about 3 months, this is how he is active. The patient who had difficulty in walking on a flat surface is comfortably walking on an uneven surface at his village, and he is driving vehicle as well, and he is living comfortably. Okay. Similarly, you can see this is how he was walking before surgery, and this is how he is walking now. Okay. So I am happy to tell that the implant, the robo what we use is a QVIS robo. Presently, it is having a counterpart which is manufactured in India. It is made in India robo. So we are happy to tell that this is one which we are happy to announce. Okay. And the next thing is similarly a patient with severe bent leg who had difficulty to walk. So this is how his X-ray looks. And on table, with this X-ray you can see there is too much of small bony particles. All these curves are osteophytes. So these were removed on table. Once all the particles are removed, the tissue becomes loose. But since the robo is there, we could comfortably balance his knee comfortably. And this is how he is walking 5 days post surgery. This is 2 weeks post surgery. Similarly, a person with both the bent leg finding difficulty to walk, and now that is how his X-ray looks. Those are the loose bodies in the knee joint, and after 6 weeks when he comes back, this is how the patient is walking. So definitely yes, conventional surgery also they would have all this benefit, but the recovery would have been not this fast, and they would never be walking this comfortably or climbing stairs this comfortably. That is the main advantage of the robotic knee replacement surgery. So these are severe deformities. Patients where the deformity is very less, where the pain factor is more, it is very convenient surgery. In a matter of 5 days, when they get discharged, they walk this way. In a matter of 2 weeks, they will be traveling back by train or by flight. So that is a comfortable thing. And since we have a robo, there is no specific that complete knee has to be replaced. Now we have come up with the uni knee, where the part of the knee which is damaged, only the damaged part is replaced, and the rest which is normal is kept. It is called uni knee. Only the part which is damaged is replaced, and the part which is healthy is left intact. Thank you.
ನಾಗರಾಜ್ ಅಂತ ನನ್ನ ಹೆಸರು. ಒಂದು 7-8 ವರ್ಷದಿಂದ ಕಾಲು ಜಾಸ್ತಿ ಇತ್ತು. ಡೈಲಿ ಪೇನ್ ಕಿಲ್ಲರು ಮಾತ್ರ ಬಳಸ್ತಾ ಇದ್ದೆ, ಆದರೂ ಉಪಯೋಗ ಇಲ್ದಂಗೆ ಆಯಿತು. ನಮ್ಮ ಅಲ್ಲಿ ಚಳಕೆರೆಯಲ್ಲಿ ಕ್ಲಬ್ನಲ್ಲಿ, ಈ ರೋಟರಿ ಕ್ಲಬ್ನಲ್ಲಿ ಮೀನು ಇದಾಕಿದ್ದರು ನಿಮ್ಮ ಕಂಪನಿಯವರು. ಅಲ್ಲಿ ನೋಡಿದ್ರೆ ಏನಿಲ್ಲ, ಕಾಲಲ್ಲಿ ಪ್ರಯೋಜನ ಇಲ್ಲ, ಆಪರೇಷನ್ ಮಾಡಿಸಿ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂದರು. ಆಗ ನಾರಾಯಣ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಬಂದು ಇದು ನೋಡಿದ್ವಿ. ದುರ್ಗಾ ಪ್ರಶಾಂತ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಮಾಡಿಸಿದ್ವಿ. ತಿಂಗಳು 22ನೇ ತಾರೀಕು ಮಾಡಿಸಿದ್ವಿ ಒಂದು ಕಾಲು, 24ನೇ ತಾರೀಕು ಒಂದು ಕಾಲು ಮಾಡಿಸಿದ್ವಿ. ಈಗ ಆರಾಮಾಗಿ ನಡೀತಿದ್ದೀನಿ, ಭಾಳ ಚೆನ್ನಾಗಿದೆ. ಇವಾಗ ಮಾತ್ರೆ ಬಿಟ್ಟಿದ್ದೀನಿ, ಚೆನ್ನಾಗೈತ್ರಿ, ಮಾಡಿಸೋದು.
ಈಗ ಮಾತಾಡಿದ್ದು ನಮ್ಮ ತಂದೆಯವರು ನಾಗರಾಜ್ ಅಂತ, ನಾವು ಅವ್ರ ಮಗ. ನಮ್ಮಪ್ಪನು ಒಂದು ನೋವು ಅನುಭವಿಸಿರೋದು ಅದು ನನಗೆ ಗೊತ್ತು. ಸುಮಾರು ಒಂದು 7 ವರ್ಷದಿಂದ ಡೈಲಿ ಪೇನ್ ಕಿಲ್ಲರ್ ನುಂಗಿ ಒಂದು ಸರಿ ಹೋಗಿ ಬಂದರೆ ಮತ್ತೆ 3 ದಿನ ಬೇಕಾಗಿತ್ತು. ಒಂದು ಎಲ್ಲಿಗಾನ ಹೋಗಿ ಬರ್ಬೇಕು, ಊರೊಳಗೆ ಏನನ್ನ ಫ್ರೆಂಡ್ಸ್ ಮಾತಾಡ್ಸ್ಬೇಕಂದ್ರೆ ಅಷ್ಟು ಅನುಭವ, ಅಷ್ಟು ನೋವು ಅನ್ನೋದು ತಿಂದ್ಬಿಟ್ಟಿದ್ದಾರೆ. ಇಲ್ಲಿ ನಾವು ನಮ್ಮಪ್ಪಂದು ಆಲ್ರೆಡಿ ಬಲ್ಗಾಲು ರಾಡ್ ಹಾಕಿದ್ದಾರೆ, ಇದು ಬಿದ್ದಿದ್ರು ಕೇರಳದಲ್ಲಿ. ಬಟ್ ಅದನ್ನ ರಿಮೂವ್ ಮಾಡ್ಬೇಕಂತ ಒಂದು 2-3 ಕಡೆಯಿಂದ ರಿಮೂವ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳಿದ್ರು. ಅದು ಒಂದು ಟೆನ್ಷನ್. ಇದೇನಪ್ಪ ಮತ್ತೆ ರಿಮೂವ್ ಮಾಡಿದ್ಮೇಲೆ ಮತ್ತೆ 6 ತಿಂಗಳು ಮತ್ತೆ ಆಪರೇಷನ್ ಮಾಡಿದ್ಮೇಲೆ ಅದೇನು ಸಕ್ಸಸ್ ಆಗುತ್ತೋ ಇಲ್ಲೋ ಅನ್ನೋದು ಒಂದು ಟೆನ್ಷನ್. ಈ ಗೊಂದಲದಲ್ಲಿ ಏನ್ ಮಾಡ್ಬೇಕು, ಏನ್ ಕಡೆ ಮಾಡಿಸ್ಬೇಕೋ ಬೇಡ ಅಂತ ಹಿಂಗೆ 2 ವರ್ಷ ದುಃಖ ಬಂದ್ವಿ. ನಾವು ಒಂದು ನಿರ್ಧಾರಕ್ಕೆ ಬಂದು ಯಾರ ಮಾತು ಕೇಳ್ಬಂದು ದೇವಿಟ್ಟಿದ್ದಾಗ ಆಪರೇಷನ್ ಐತಲ್ಲ ಕಾಲಿತ್ತು, ಅದನ್ನು ನೋಡೋಣ, ಅಲ್ಲೊಂದ್ಸರಿ ಚೆಕ್ ಮಾಡೋಣ ಡಾಕ್ಟರ್ ಹತ್ರ, ಆಮೇಲೆ ಡಿಸಿಷನ್ ತಗೊಳ್ಳೋಣ ಅಂತೇಳಿ ಚೆಕಪ್ ಬಂದ್ವಿ. ನಾವು ಬಂದಾದ ನಂತರ ಅವ್ರು ಇಟ್ಕೊಂಡು ಇದು ರಾಡ್ ಹಾಕಿದ್ದಾರೆ ಸರ್, ಮತ್ತೆ ಬೇರೆ ಕಡೆಯಿಂದ ನಮ್ಗೆ ಹಿಂಗೆ ಅಪೋಸಿಟ್ ಹೇಳಿದ್ರು ಮತ್ತೆ ಮಾಡ್ಬೇಕು. ಈಗ ರೋಬೋಟ್ ಸಿಸ್ಟಮ್ ಇರೋದ್ರಿಂದ ನಿಮಗೆ ಈ ಆಪರೇಷನ್ ಆರಾಮ್ಸೆ ಮಾಡ್ಬೋದು. ಮೊದಲವಾಗಿದ್ರೆ ಅವನ್ನ ಮಾಡಕ್ ಬರ್ತಿರ್ಲಿಲ್ಲ, ಅದು ತೆಗಿಲೇಬೇಕಾಯ್ತು ರಾಡ್ ನಮಗೆ ಬಹಳ ಪ್ರಶಾಂತ್ BN ಡಾಕ್ಟರ್ ಬಲ ಕೊಟ್ಟರು ನಮಗೆ. ಆ ಒಂದು ಧೈರ್ಯದಿಂದ ಮತ್ತೆ ನಾವು ಬಂದಾದ ನಂತರ ಮಾಡಿಸಿದ್ದಾದ್ಮೇಲೆ ಬಹಳ ಚೆನ್ನಾಗಾಗಿದೆ. ಫಸ್ಟಿಗೆ ಸ್ವಲ್ಪ ನೋವು ಅನಿಸ್ತದೆ ಎಲ್ಲರಿಗೂ, ಯಾವುದೇ ಆಗಲಿ ದೊಡ್ಡ ಆಪರೇಷನ್ ಕಾಲ್ ಆಪರೇಷನ್ ಕೊಯ್ಲೇಬೇಕಾಗುತ್ತೆ, ಕಾಲುಗಳು ಎಲ್ಲಕ್ಕೂ ಧೈರ್ಯ ಕೊಟ್ಟು ನಾವು ಆಪರೇಷನ್ ಮಾಡಿಸಿದ್ವಿ. ಬಟ್ ಬಹಳ ಚೆನ್ನಾಗಾಗಿದೆ. ಒಂದು 15 ದಿವಸ ಆದ್ಮೇಲೆ ರಿಸಲ್ಟ್ ಸಿಗುತ್ತೆ. ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಫಿಸಿಯೋಥೆರಪಿನೂ ಅಷ್ಟೇ ನೀಟಾಗಿ ಮಾಡಬೇಕು. ಅಷ್ಟೇ ನೀಟಾಗಿ ಮಾಡಿದ್ರೆ ಅಷ್ಟೇ ಸುಂದರವಾಗಿ ಬರುತ್ತೆ. 2 ಕಾಲು ಸೂಪರ್ ಆಗೈತೆ. ಎಲ್ಲ ಸರೋಗದ್ಮೇಲೆ ಮಾತ್ರೆ ಬಿಡ್ತಾರೆ, ಎಲ್ಲ ಬಿಡ್ತಾರೆ, ಸುಖವಾಗಿ ನಡೀತಾರೆ, ಅವ್ರ ಜೀವನ ಅವ್ರು ರೂಪಿಸ್ಕೊತಾರೆ. ಈಗ ಅವ್ರಿಗೊಂದು ಶಕ್ತಿ ಬಂದಿದೆ ಅಂತ ನಾನು ಅನ್ಕೊಂತೀನಿ. ಬಟ್ ಇಷ್ಟೇ ನಾನು ಮಾತು ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ದಯವಾಗಿ ಮಾಡಿಸಿ. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Hi, I am Dr. Prashant Ian, robotic arthroplasty surgeon from Narayana Health, Bomsandra. So today we will discuss about a patient by name Nagaraj. He is a gentleman of 65-year-old. He had a femur fracture around 7 years back, which was operated in some Kerala by plane and screw fixation. So by lucky with the surgery, everything has went well. His fracture has united. Now he has come with a problem in the knee. His both knees are damaged. They are progressed to stage 4 osteoarthritis, where his both the legs are in varus. He is finding difficult to walk with that leg. So he is keen on getting a surgery done, but the problem is there is a metallic implant inside. So for knee replacement, in a conventional technique, if you want to do, we have to take those implants so that we can put a intramedullary rod there to get the alignment. But luckily, we have a robotic. This alignment is done by a robot. So the need to take the implant out is not there. So one major surgery can be avoided on him. So since this becomes a smaller surgery, we could club this surgery with the other knee, which is also damaged. So we did knee replacement for both his knee in one setting without taking out the implant, which went on well. Patient was comfortably going to toilet and come back in a matter of 1 week, and he was comfortably walking in a matter of 10 to 15 days. So then now he is continuing his daily activities. He is comfortably driving a 4-wheeler also. He is very happily living now.
Everyone, I welcome you all on behalf of Narayana for this August gathering. I think my colleague Dr. Prashant has given you a brief introduction of what robotics is and how the planning is done. I would like to talk more from a patient perspective and then what is the experience from a patient. Now, what is robotics? Can you guys hear? Yeah, we all know robotic is a tool which makes our life easier. That's a simple definition for robot. Now, robots are there everywhere, right? So it's an era of robotics. Now, we have robotics in medical field now. So we have a robot in orthopedics as well. So there is a misconception that single robot in medicine can do all the surgeries. No. So every specialty has their own robot. For example, there is a robot which do only the abdominal surgeries, and the robot which we are talking about today is the robot which is only used for joint replacements. So today we are here to impress upon the importance of robotics in joint replacement. Now, we have been doing joint replacement from almost 2 decades now. However, there is always been an issue from the patient satisfaction. Now patients come, they do the surgery and then they do reasonably well. However, in the society there is a talk that, oh, I got a surgery done and I'm not doing well. Now the medical fraternity has always been thinking, what is the reason why these patients are not happy after the knee replacement? Now, is it because the surgery is not minimally invasive, or there is too much of tissue damage, or the alignment of the leg, which Dr. Prashant showed, is always better with robotics? So are these the reason why the patient is not happy? Now, if that is the reasons, then robotics is going to be the answer and the future of joint replacement. what are the so what is the fundamental difference between robotic surgery and a manual surgery? Robotic surgery helps us to do the planning of a joint replacement before the surgery. It's like a virtual planning. So before I do the surgery, I know what exactly I'm going to do, which is not possible with a manual surgery. So I'll only open the knee joint, then only I know what I'm going to do. Whereas virtually I can plan the surgery. That's the advantage of robotic surgery. And the second one is, it is minimally invasive and we can do the surgery with a lesser scar. Patients are more comfortable and they do recover well compared to a manual surgery. Does that mean a manual surgery is not good? No, it's not. Manual surgery is definitely good. But when the technology is available, you should use the technology to our advantage. Now at Narayana Hospital, as a organization, we always believe in passing the technology and the benefits to the patient. Hence, whatever the latest technology are there in the field, we are always very happy to adopt them. So even in this case, robotic joint replacements we are doing at a very reasonable cost compared to most of the hospitals across India. At the same time, we are not burdening our patients with the technology. We as an organization believe that technology is there for patients' benefit, not to burden the patient. Now we have n number of patients who had a very good experience, pleasant experience having a knee replacement with us. Once a gentleman is here, we will have a discussion, the patient feedback discussion with them. But what I just want to reiterate and impress upon is, robotic technology is here to stay and it is benefiting the patients. And many of the patients who were afraid initially to undergo surgery because of
ರೋಬೋಟಿಕ್ ನೀ ಸರ್ಜರಿಯಿಂದ ನಮ್ದು ನೀ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಸರ್ಜರಿ ತುಂಬ ಈಸಿ ಆಗಿದೆ. ಇದರಿಂದ ತುಂಬ ಪೇಷಂಟ್ಸ್ ಬೆನಿಫಿಟ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ನಾರಾಯಣ ಹೆಲ್ತಲ್ಲಿ ನಾವು ಈಗ ಆಲ್ರೆಡಿ 300ಗಿಂತ ಜಾಸ್ತಿ ಸರ್ಜರೀಸ್ ಮಾಡಿದ್ದೀವಿ. ಎಲ್ಲ ತುಂಬ ಸಕ್ಸಸ್ಫುಲ್ ಆಗಿದ್ದಾರೆ, ರಿಕವರಿ ಚೆನ್ನಾಗಿ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಈ ರೋಬೋಟಿಕ್ ನೀ ಸರ್ಜರಿಲಿ ನನಗೆ ಹೇಳಿದಿರೋ ಹತ್ರ ತುಂಬ ಸಣ್ಣ ಇನ್ಸಿಷನಲ್ಲಿ ಆಪ್ರೇಷನ್ ಮಾಡ್ಬೋದು, ಮಸಲ್ ಕಟ್ ಮಾಡೋ ಅವಶ್ಯಕತೆ ಬರೋದಿಲ್ಲ. ಅದೇ ರೀತಿ ಅದಿಲ್ಲದಲೇ ಇರೋದ್ರಿಂದ ಬ್ಲಡ್ ಲಾಸ್ ತುಂಬ ಕಡಿಮೆ. ಹಾಗಾಗಿ ಪೇಷಂಟಿಗೆ ಪೇಯ್ನ್ ತುಂಬ ಕಡಿಮೆ ಇರುತ್ತೆ. ಓಲ್ಡ್ ಏಜಲ್ಲಿ ಈ ಪೇಯ್ನ್ ಮೆಡಿಕೇಷನ್ ತುಂಬ ಕೊಡೋ ಅವಶ್ಯಕತೆ ಇರೋಲ್ಲ, ಅವರು ರಿಕವರಿ ಫಾಸ್ಟಾಗಿ ಆಗ್ತಾರೆ. ಹಾಗಾಗಿ ಫಿಸಿಯೋಥೆರಪಿ, ಎಕ್ಸಸೈಸಸ್ಸು ಅದ್ರ ಬಗ್ಗೆ ಅದರಿಂದ ಬರ್ತಕ್ಕಂಥ ಪೇಯ್ನು ತುಂಬ ಅನುಭವಿಸೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಸೊ ಫಾಸ್ಟಾಗಿ ರಿಕವರಿ ಆಗುತ್ತೆ. ಇಟ್ಸ್ ಡೆಫಿನೆಟ್ಲಿ ವೆರಿ ಯೂಸ್ಫುಲ್. ಇಫ್ ಯು ಹ್ಯಾವ್ ಎನಿ ತೊಂದರೆ ಇತ್ತು ಅಂದರೆ ಇದು ತುಂಬ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಅಂತಂದರೆ ನಮ್ಮನ್ನು ಭೇಟಿ ಮಾಡ್ಕೊಂಡು ಯು ಕ್ಯಾನ್ ಪ್ರೊಸೀಡ್ ವಿತ್ ದ ಸರ್ಜರಿ.
ಲೈಫ್ ಲಾಂಗ್ ಕ್ಯೂರಿಟಿ ಆಗುತ್ತೆ.
ಲೈಫ್ ಲಾಂಗ್ ಅನ್ನೋಕ್ಕೆ ಇದು ಎಷ್ಟೋ ಫ್ಯಾಕ್ಟ್ರಿಗಳು ಇನ್ವಾಲ್ವ್ ಆಗುತ್ತೆ. ಡೆಫಿನೆಟ್ಲಿ 25-30 ವರ್ಷ ಕಂಫರ್ಟಾಗಿ ಬರುತ್ತೆ. ಬಟ್ ಈ ನೀ ಇಂಪ್ಲಾಂಟ್ ಹೇಗಿದೆ, ಈ ಪೊಸಿಷನ್ ಹೇಗಿದೆ, ಆ ಪೇಷಂಟ್ ಬಾಡಿ ವೆಯ್ಟ್ ಏನಿದೆ, ಅದ್ರ ಮೇಲೆ ಎಷ್ಟು ಒತ್ತಡ ಬರುತ್ತೆ, ಅವ್ರು ಏನು ಆ್ಯಕ್ಟಿವಿಟಿ ಮಾಡ್ತಾರೆ,
ತುಂಬ ಫ್ಯಾಕ್ಟರ್ಸ್ ಇದಕ್ಕೆ ಕೌಂಟ್ ಆಗುತ್ತೆ. ಬಟ್ ಡೆಫಿನೆಟ್ಲಿ ಮುಂಚೆ ಇರ್ತಕ್ಕಂಥ ಇಂಪ್ಲಾಂಟ್ಗಿಂತ ಇದು ತುಂಬ ಜಾಸ್ತಿ ಬಾಳಿಕೆ.
ಸರ್ ಏನು ಆಪ್ರೇಷನ್ ಕಾಸ್ಟ್ ಏನಿದೆ ಸರ್ ಇದು ಒಂದು ಇದು?
ಆಪ್ರೇಷನ್ ಕಾಸ್ಟು ಪೇಷಂಟ್ ಪ್ರತಿಯೊಂದು ಪೇಷಂಟಿಗೂ ವೇರಿ ಆಗುತ್ತೆ. ಅವ್ರಿಗೆ BP ಇದೆಯಾ, ಶುಗರ್ ಇದೆಯಾ, ಸರ್ಜರಿ ಆದಮೇಲೆ ಬ್ಲಡ್ ಬೇಕಾಗುತ್ತಾ, ಅವ್ರು ಆಪ್ರೇಷನ್ ಥಿಯೇಟ್ರಿಂದ ICUಗೆ ಹೋಗ್ತಾರಾ, ಇಲ್ಲ ಡೈರೆಕ್ಟಾಗಿ ವಾರ್ಡಿಗೆ ಹೋಗ್ತಾರಾ, 3 ದಿನ ಇರ್ತಾರಾ, 5 ದಿನ ಇರ್ತಾರಾ, ಇದು ತುಂಬ ಫ್ಯಾಕ್ಟರ್ಸ್ ಕೌಂಟ್ ಆಗುತ್ತೆ.
ಸರ್ ಒಂದು ಸೆಕೆಂಡ್.
ಹಾಂ, ನಾನು ಡಾಕ್ಟರ್ ಅಭಿನಂದನ್ ಪುನೀತ್, ಆರ್ಥೋಪೆಡಿಕ್ ಮೂಳೆ ತಜ್ಞರು. ನಂದು ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಮತ್ತು ಸ್ಪೋರ್ಟ್ಸ್ ಮೆಡಿಸಿನ್ ಸ್ಪೆಷಾಲಿಟಿ. ಈಗ ನಾರಾಯಣ ಹೆಲ್ತಲ್ಲಿ ನಾವು ರೋಬೋಟಿಕ್ ನೀ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ನ ಮಂಡಿ ನೋವಿನ ಜನಗಳಿಗೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಈಗ ಸುಮಾರು 300 ಕೇಸ್ಗಳನ್ನ ಸೇಫ್ಲಿ ಮಾಡಿದ್ದೀವಿ. ಎಲ್ಲ ಪೇಷಂಟ್ಗಳು ಚೆನ್ನಾಗಿ ಸ್ಯಾಟಿಸ್ಫೈ ಆಗಿದ್ದಾರೆ. ನಾನು ಏನು ಒತ್ತಡ ಹಾಕಿ ಹೇಳೋದಂದರೆ, ಮೊಣಕಾಲು ನೋವಿದ್ದಾಗ ದಯವಿಟ್ಟು ಅದರಿಂದ ಸಫರ್ ಆಗಬೇಡಿ. ಅದಕ್ಕೆ ಸೇಫಾಗಿ ಸರ್ಜರಿ ಮಾಡ್ಬೋದು. ಆಮೇಲೆ ನೀವು ಎಲ್ಲ ದಿನನಿತ್ಯದ ಜೀವನದ ಸುಖಗಳನ್ನ ಅನುಭವಿಸ್ಬೋದು. ನೋವನ್ನು ತಿನ್ನೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ನಾವು ಸೇಫಾಗಿ ಏನು ತೊಂದರೆ ನಿಮಗೆ ಆಗದೇನೆ ಆಪ್ರೇಷನ್ ಮಾಡ್ಬೋದು ಬಿಕಾಸ್ ಆಫ್ ದ ಟೆಕ್ನಾಲಜಿ. ನಿಮಗೇನಾದರೂ ಮೊಣಕಾಲಲ್ಲಿ ತೊಂದರೆ ಇತ್ತು ಅಂದರೆ ನಮ್ಮನ್ನು ಬಂದು ಕಾಣಿ, ನಾವು ನೋಡಿಕೊಂಡು ನಿಮಗೆ ಹೆಲ್ಪ್ ಮಾಡೋ ಸಾಧ್ಯತೆ ಇದೆ. ನಮ್ಮಲ್ಲಿ ಇದು ಸ್ಕೀಮ್ ಕೂಡ ಇರುತ್ತೆ. ಹಾಗಾಗಿ ಯಾರೇ ಪೇಷಂಟ್ ತೊಂದರೆ ಇದ್ದರೆ ಅದನ್ನು ನಾವು ಅವರಿಗೆ ಸಹಾಯನೂ ಮಾಡ್ತೀವಿ.
ಸರ್ ಸರ್ಜರಿಗೆ ಎಷ್ಟು ದಿನ ರಿಕವರ್ ಆಗ್ತಾರೆ ಸರ್ ಪೇಷಂಟ್?
ಈಗ ಪ್ರತಿಯೊಂದು ಪೇಷಂಟು ಬೇರೆ ಬೇರೆ. ಈಗ ಪೇಷಂಟ್ಗೆ ಏನು ತೊಂದರೆಗಳಿದ್ದಾವೆ ಅದ್ರ ಮೇಲೆ ಡಿಪೆಂಡ್ ಆಗುತ್ತೆ. ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಮಾಡೋದ್ರಿಂದ ನನ್ನ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಪ್ರಕಾರ 1 ಕಾಲು ಮಾಡಿದರೆ 15 ದಿವಸದಲ್ಲಿ ರೆಡಿ ಆಗ್ತಾರೆ ಪೇಷಂಟು. 2 ಕಾಲು ಮಾಡಿಸ್ಕೊಂಡಾಗ 3 ರಿಂದ 4 ವಾರದಲ್ಲಿ ಕಮ್ಯುನಿಟಿ ಆ್ಯಂಬುಲೇಟ್ರಿ ಹೊರಗಡೆ ಮನೆಯಿಂದ ಹೊರಗೆ ನಡೆಯೋಷ್ಟು ಕ್ಷಮತೆ ಬರುತ್ತೆ.
ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಮಾಡೋದ್ರೆ ಫಿಸಿಯೋಥೆರಪಿ ಅವಶ್ಯಕತೆ ಇದೆ?
ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಮಾಡೋದ್ರಿಂದ ಫಿಸಿಯೋಥೆರಪಿ ನೀಡ್ಸು ಕಡಿಮೆ ಆಗುತ್ತೆ, ಎಲಿಮಿನೇಟ್ ಆಗಲ್ಲ. ಫಿಸಿಯೋಥೆರಪಿ ಬೇಕಾಗುತ್ತೆ, ಬಟ್ ಕಡಿಮೆ ದಿನದಲ್ಲಿ ಫಾಸ್ಟಾಗಿ ರೆಡಿ ಆಗ್ತದೆ. ಮೂವ್ಮೆಂಟು ಚೆನ್ನಾಗಿ ಬರುತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು.